COVID-19 said the Hunsum is Korean Mahuda etu na mampanika so duja echiremu se World Health Organization for ehwehwe mu bia o maye ne adwempo bia o de aba no wo muso mkromu pinti o manga de ye adwuma na no ne ene se enka ne no se ase obi nya COVID-19 ni bia pe no bia so se bi onipa no betumi de asan krofo ana mampanika se nhwemu a ye kire se obi wo ho a na wonya COVID-19 ni bi nanso ahyenso de ahodo a ebeche so onipa no obi no na woni bi safo no omo trafa sayare no ensan na no achi so ye test onipa no wie na wotwe mienu ntam na ye hwese bi onipa no na ho to no ba na sefo no a so mo san ye bi o hwese anya bi onipa no wanya hode edi mu ana nyama yi ni nyama hodo bebiri na mama nka bom ko na so ye a hwa pomdu nsam so de aba omanga na so ye kura mu pintin edi ye adwuma eboa amasese no yare no so tia na eti ewo omanga na mu.
Our approach to dealing with the virus, as I've always said, will be informed by the evolving science and data. At the outset of the pandemic, the scientific community and the World Health Organization, WHO, on 12 January 2020, recommended two main criteria for declaring someone who was tested positive as having recovered from the disease. The first is that you no longer have symptoms, and the second is that you're no longer capable of infecting others. Initially, the scientific thinking was that as long as you continue to test positive, you're capable of infecting others. Hence the requirement for the 2 consecutive negative tests before you're declared as having recovered. This was the science that informed the guidelines that Ghana has so far followed. However, there's now new evidence which states that after 10 to 14 days, a person with no symptoms is unlikely to transmit the virus to others, even if the person continues to test positive. It is on this basis that WHO has updated its guidelines as published per its Clinical Management of COVID-19 Interim Guidance of 27th May 2020, quote, as part of the clinical care pathway of a COVID-19 patient, unquote. According to WHO, asymptomatic patients, i.e., those who have tested positive for the virus but are not exhibiting any symptoms after 14 days, quote, are not likely to be infectious and therefore are unlikely to be able to transmit the virus to another person, unquote. After 3 weeks of analyzing and studying this update and recommendation and situating it in the Ghanaian context, in line with the admonition by WHO to member states, this new patient discharge recovery policy has now been adopted by Ghana, as have some countries in the European Union, Singapore, India, Malaysia, Hong Kong, and Dubai. As of Saturday, 20th June, the total number of positives cumulatively stands at 14,154 out of the 270,300 tests conducted. Under the revised policy, 5,925 persons have recovered and been discharged. This brings the total number of recoveries to 10,473,